But we want to follow up on different speakers who will wrap it up around the recommendation for the way forward. And I would like to introduce our speaker in the open ceremony is joining us online. Is the Director of Public Health, Security, and Social Protection Division at the Africa Development Bank, Dr. Babatunde Omilola. Welcome to make your remarks. All right, we'll circle back to Dr. Babatunde once he's able to join. I would like to call our next speaker to give us reflections, possible way forward, recommendations. He is the chair, Department of Hematology and Oncology at Aga Khan University Hospital, Professor Mansour Saleh. Let's give him a clap as he comes.
So thank you for inviting me. I was just listening to the previous speakers talk about vasectomy and erectile dysfunction. I'll talk about something less anatomic. I was looking for the blue pill booth, but I couldn't find one. I hope there's one next time. Is there one, a blue pill booth out there somewhere? So, yeah, I direct the cancer program at AKU, and I moved to Kenya approximately 2 years ago, just before COVID, and we have established a clinical research unit. But for the project we talk about today, I'll talk about the following information. Most men need to pay more attention to their health compared to women, mainly because, next slide, because men smoke and drink more than women, men make unhealthy and risky choices, and men put off regular checkups and medical care. And we heard about this in the last sessions. It is a result of that the average lifespan of a man in Kenya is 63 years compared to 68 or 69 for women, primarily because while we may be less at risk, we really take things, we take things a little bit lightly, and we're not paying attention as much to our health. The next slide will tell us a few things about the consequences that men face because we take high-risk behavior. More men die of heart disease than women. Cancer, second most common cause of death in men, yet we don't do very much about it in terms of early detection. Diabetes, more so in men compared to women. Certainly erectile dysfunction, we talked about it. HPV, it is surprising that we promote HPV vaccination for young girls. But the primary cause of infection of the young girl is a young boy. Yet we really hardly talk about young boys getting HPV vaccination. Then when it does happen, we always are concerned about HPV causes cervical cancer. HPV is the most common cause of oral cancer, throat cancer, and we see more of it here in Kenya, specifically the northwestern part of Kenya. So we have HPV infections for a variety of reasons. So I think protecting our young boys and girls today will help both cervical cancer 10 years from now, as well as oral cancers 10 years from now. But we have to then be gender equal. Both young boys and young girls have to be vaccinated. we have not talked about a lot of it. Depression. Mental health is Kenya's president's first call of action. And I can tell you that most men will deny ever having had depression or mental health issues. We need to face up to it. And I think part of it will be hopefully talked about during the Q&A discussion. But we have to, one, agree that it occurs. Number two, we have to own up to the fact that it could be happening to us. And number three, you have to agree that there are ways to combat mental health because it affects productivity, livelihood, and quality of life. Next slide. So we'll talk a little bit about cancer because I'm an oncologist. If you look at men in Kenya, life expectancy, as I said, 36 years compared to women, 68. The most common causes of death in Kenyan men in terms of cancer, prostate cancer, esophageal cancer, colorectal cancer, Hodgkin's lymphoma, and then stomach cancer. Of the ones that I've highlighted with an arrow, they are all early detected or prevented. Prostate cancer, we've talked about it. Her Excellency came here and talked about her husband's experience. PSA is really life-saving, but we don't do it often enough. African men have a high incidence of prostate cancer than the Caucasian men. In North America, where I come from, you get screened for prostate cancer at the age of 50. In Kenya, we should screen men at the age of 40. We have a high-risk gene in African men that predisposes us to prostate cancer. Can you prevent? Answer is yes. We'll talk about it. Can you early detect? Absolutely. Yeah, we do not do that. If you pick up a cancer, as was talked about by our own speaker here, early detection with PSA is a 100% chance of cure. Whether you go for surgery or CyberKnife that we heard about, there clearly is a benefit to it. It's a blood test, very simple, no rectal examination required today. However, only 10% of Kenyan men get a PSA test every year beyond the age of 40. Less than 20% of men above 50 in Kenya get a PSA test. So I think we will talk about how to encourage our men and women to be participating in early detection. Colorectal carcinoma, very easy. A rectal examination, not sufficient. Colonoscopy. Colonoscopy takes 10 minutes, in fact, 8 in the US. They give you Versed, makes you sleep, you wake up. The only problem is when you get Versed, it is sort of a low anesthesia. You give away your secret. So you better make sure that whoever takes you to a colonoscopy is not somebody you do not want to tell your secrets to. That's the only side effect of a colonoscopy. Yeah. You gotta decide who you take you with you, obviously. The Matatu guy would be the best guy. He takes you there, brings you back. It doesn't matter what secrets you share with him. In terms of stomach cancer, we do not have early detection, but our diet clearly is responsible for that. So of the top 5 cancers, 3 can be prevented, 4 can be early detected. We did not perform this here in Africa. And I think the AHB conference should really talk about how do we promote the federal government, the private sector, and the public sector to work together on behalf of men. Next slide. So you cannot deny destiny. As I told my colleague recently, destiny is meant to happen. But fate, you can dictate fate because how you respond to destiny. So next slide. Making health a priority. I think this conference symposium is part of it. Number 2, prevention is indeed possible. We'll talk about it during the Q&A. And number 3, early detection is a necessity. And the last point I'm going to make is lifestyle choices can make a difference and give yourself an early Christmas present. You know, I see this in Kenya all the time. On Valentine's Day, the women are prettily dressed. The men are all in suits, going out, great for the economy. And I tell myself, by the time the woman comes back the next day on the 15th of February, she's washing dishes, washing clothes, it's all forgotten. I would rather say that if you really love your woman, give her a mammogram as a gift. And if you really love your man, give him a PSA test as a gift. So we can talk about it very soon during the Q&A answers. So those are my slides. Thank you.
Please join us on the stage. Thank you, Professor Mansour. We shall consider those gift options. I'd like to call To join Professor Mansour on the stage, Dr. Elizabeth Wala, who is Board Director at Kenya Private Sector Alliance. I would also like to call our Executive Chairman of Africa Health Business, Dr. Amit Thaka, to join them on the panel. And I'd like to call up the moderator of this panel discussion as we wind up, Mrs. Maluz Kibacha. Thanks.
Hi, everybody. You're still here to the end. Great. Thanks. Having been here for the past, what would it be? We started around 9. It's now 6:15. Yeah. 9 hours, 15 minutes. What have we heard? What have we learned? About one thing that really struck me, and also as I compare it to the women's health event that we hosted in February. And now 6 months later, we're doing men's health. What is the difference? I think the main difference I've been seeing is health-seeking behavior, delaying. Prevention is better than cure. Incorporating wellness into the daily routines of men. Let's not wait till it's stage 4 of cancer, but nip it in the bud when it's stage 1. When you're hypertensive, don't wait till it becomes diabetes. And there are tons of other examples that I've heard throughout the day in terms of prevention is better than cure. But how do we get these men to the clinics? How do we get them to be not scared? And personally, this is really of interest to me, because if you look at the podium there, it's full of men. Just down there under the stage podium, this small picture, those are all men. 2 boys, 30-year-old something guy, and a guy in his 60s. Those are my men. That's my husband. Those are my kids. It's my dad-in-law. You know, it runs home to me. I don't have daughters. And my family, my birth family, my parents are in the Netherlands. I'm Dutch. But my family is African now. And those are all African men. So I have a vested interest in this. And I have a love for African men, not only because of them, because of the wider ecosystem. And I think really it's an ignored discussion that we've been having, as I've been hearing throughout the day. There's been a lot of attention, and rightfully so, for women's health, reproductive health, women cancers, the like. And that should be the case, but let's not forget the men. And that's why I'm very happy and proud that as AHB today, we've been able to organize this event. If you compare it to how women's health was, we had the entire space. Now we were split. We have less than half of the participants we had than we had at women's health. But still, it's to us a success because we're starting somewhere. And the start is maybe here compared to women's health discussions, they are here. But you have to start somewhere. And as AHB, we are very proud to start those discussions. Also from an in Africa, by Africa, for Africa perspective, because we are an African company and we are in this continent, for this continent and by Africans. So I would like to state that just to start with and to set the stage and just to reflect back on what we have heard. And I'm very happy to be here with the 3 of you to wrap up and to basically discuss off the cuff what are our ideas on men's health and how can we promote wellness and make it closer to the men and make it easier accessible in whatever way, and what does that mean? And thank you, Dr. Mansour, for your very interesting brief overview that you gave. And you are a medical specialist. You see men in your practice every day. Prevention, as you mentioned, is key. And how do we, my question to you, as based on your experience in your practice every day, how can we incentivize men to not wait till it's stage 3, 4, but at the beginning of their journey, a health-seeking journey, and yeah, focus on that prevention, but also the early screening parts. Yeah, what can we do to incentivize men to seek help or care earlier?
It's an important question. It's a question that is not only an African problem, it's a world problem. One is awareness. I do not think we do enough about awareness of major issues that affect the men. Hypertension, diabetes, cancer. Those are the 3 most common killers. But yet we deny access to them because we did not inform our men about that. Secondly it's got to be a public-private enterprise. The federal government has to be able to subsidize a PSA, a colonoscopy, a mammography, a pap smear, number 1. The private sector, when you have men or women working with you, incentivize them to come on prostate cancer month to get their PSA done. Give them a subsidy. We get at work at the University of Alabama, where I come from, a pedometer. If you walk so many steps per day, your health insurance rate that you pay, in addition to what the hospital pays, is reduced by 10%. I think we should do that. I think so. There are a number of incentives where we can really encourage. Monetary incentives are very good, and there are many ways we can do that in trying to incentivize the public sector for their employees to be able to be encouraged for early detection and certainly prevention as well. And I didn't talk much about prevention. Low fat, high fiber, exercise, starting at the age of 16, has been shown to be beneficial, reducing 5 of the most common cancers in the world. Kenyans are runners. I see many of them at Karura, but that's only on weekends. They walk very slowly, gossiping, talking about things. That's not running. Yeah, there's something different.
Thank you very much, Doctor. Dr. Wala, my question is to you, and we know you wear many hats. Your hat today is that of, as Daniela said, board member of the Kenya Private Sector Alliance. And of course, we are here amongst health people, so to say. But from a broader private sector perspective, what do you think that private sector can do to advance women, men's health? Freudian to speak, but yeah, what can they do? Not the health, but private sector in general.
Okay, thank you so much. And congratulations, HB, for taking the bull by the horns and starting these conversations. So my name is Dr. Wala. I'm wearing my KEPSA hat as a board director. Maybe for those who don't know about KEPSA, it's an umbrella body for private sector players within Kenya. And we have different sectors ranging from health to transport to manufacturing. Basically, anyone who's not state is eligible to be a member of KEPSA. So KEPSA promotes ethical business practices amongst its members. And I remember during the COVID-19 response, we had a toll-free line, 1196, that was very, very critical in terms of businesses getting to know a lot about how they can protect their employees against COVID-19. And then we realized there was a lot of GBV that was happening, gender-based violence. And gender-based violence, most people look at it from a women's perspective because we know the burden is on the women, but we had quite a number of men who are undergoing GBV during the COVID-19 period. So what we did is that we used the same toll-free line. We partnered with another organization that works with men who undergo or are survivors of gender-based violence. And believe you me, those calls used to come using that toll-free line, meaning that I think sometimes it's just the avenue of communication that, and privacy, I think it's been repeated over and over. The other thing we've done is we have a GBV policy that we drafted as Kenya Private Sector Alliance that all our members subscribe to. So within the business, all the businesses are supposed to, adopt that GBV policy. And the GBV policy during the workplace affects both men and women, and it's all about, a lot of it has a lot to do with mental health. Then last but not least, we are talking about businesses and wellness. So most of our members have wellness programs within their own business fraternities, and most of these are covered under insurance covers. So for the places where money is an issue, finances is an issue in terms of accessing healthcare, for our members, most of them have their employees covered within this. And there's a lot of encouragement towards men accessing these services and actually going for those checkups that are there. Thank you very much.
Thank you, Dr. Wala. Amit, my next question is for you.
Yes.
More from the private health sector angle. And I've heard you say, we work together, right? So I hear him speak a lot. And I've heard you say many times, bring health to the homestead. It's there where things happen.
Correct.
When you reflect back on today and thinking of men accessing health at the homestead, what can the private health sector in particular do to advance that?
So I think when you started saying that men are a little bit slow in taking preventive care, doing checkups, we heard about PSA being given as a gift during Valentine and all this. You also heard earlier that if a man has a 4 o'clock appointment, and if the doctor is busy for up to 4:15 or something, the man will walk away. And I think it's just the nature. Either it's impatience, and the second thing is they don't take it very seriously. And there may be need for private sector to make it convenient for men. If you can buy a beer so easily, maybe you should be able to get even tests that easily. So when you talk about homestead, I think remote patient monitoring and remote collection of specimens and the ease of getting this diagnosis done will transform men's health. I think that is what also differentiates how a woman and a woman takes a little bit more seriously the whole, which is great. And we've learned that today. So I think remote patient monitoring by private sector. I've also seen nowadays, I think before COVID, people never used to come to your home to collect specimens. Now, remember when we were traveling, when you needed PCR, they came to your office and they came home. They never did that before. And then what they did, besides PCR, now you can call them to do any other test. And in fact, now you can call the labs to do your PCA, your blood test, your urine test. So that convenience is great. It's going to change. I don't know, Samuel, whether you're sending your team members or phlebotomists from the labs, and you've started doing that. In fact, you can ask a restaurant, how much business do you do with diners coming to your tables? And how much business do you do with takeaway? So now I should be asking Samuel, how much business are you doing in your lab, and how much is your takeaway? Would you do, say, 20%? Is it going to about 20? If 30% of his business at Pathcare is from home collection, which was zero, it shows. And I'll tell you, men will prefer that. So my answer to you, Malus, is that what private health sector can do is innovations around remote patient monitoring, remote collection of specimens. And I also heard earlier about apps. Not sure we've really reached there, but I think if we have good apps, health apps, that will continuously tell the men, regularly updating them about what needs to be done, and the PDF of your results that come from the labs should be easily read by an AI program about your cortisol levels, about your hormonal levels. It should be telling you the inner age, and it should be giving you a trend. It should be telling you, you know, the kind of food that you're eating and the kind of exercise that you're doing and the fat and fiber diet. If I do all that, what you were saying, is it being seen on my health records? And if I see a positive trend, then instead of Karura, just on weekends, you might see this happening. I also thought, Malus, one other incentive I would like to add is if you buy a car insurance and you don't have an accident, you get something called no claim bonus every year. And in fact, that no claim bonus starts reducing your premium. So now I'm saying in healthcare, if you look after your health and you do what you were saying, Professor Mansoor, and you improve your BMI, and if you improve your health and your PSA is negative, you should get a discount in your premium. When you get a discount every year of 10% because you looked after your health, you will continue doing so. But if your BMI goes up and you are not doing the regular exercises, maybe your premium should go. So you might get one premium going higher, one premium going. So a discounted premium could be a financial incentive which will help the insurance company as well as the homestead, as well as the family will be happier. So these are some ideas, I think. And finally, the private sector can also get involved in the advocacy. And we took a punt. We remember when you told me a few months ago that we should do women's health. And she was very insistent. And I said, okay, Malus, if we're doing women's health, we should go ahead. But what about men? And this is where we are. And we actually debated this in the boardroom. And she said, we must do women's health. We did it. We've got a whole movement in Africa. We are going to try and make women's health much better. We didn't know how this was going to work. But honestly, I've learned so much for the day. I've learned that it is a topic that people haven't dabbled into. We needed some kind of trend setting. And I've learned that people are ready to take men's health to the next level through partnership and collaboration. I'm happy we did it. Thank you.
Thank you.
If I may just add, well, I love the fact that the Matatu guy can come and draw my blood and tell me that you've got an abnormal cholesterol, etc. Without active intervention, if that knowledge is not converted to action, then we will miss the boat. Early detection by itself is not beneficial to alter my quality of life or my longevity unless that early detection information is actionable. So what do we do when PathCare finds out a high PSA? We heard about from the governor. His doctor says, well, don't worry about it, we'll follow you. So what does PathCare or anybody who does the Matatu ride for early detection via blood testing or PCR? What is the responsibility of that entity to make sure that that pathology is followed through?
I don't know legally. Legally, can you say, listen, I found your test to be high. Have you done ABC? And then the patient will say, no. And then Samuel calls him again after 2 weeks. Have you gone for any? No. So I think it's a matter of a nice way of telling the patient, have you gone for medical advice? Labs generally give you the result, but they leave you to implement your health. If you ignore it, they can't do anything. So that's a good point you're raising.
So if we link that result with the physician who may have ordered it, or at least some way to link that up with a clinical care provider, that to me is real action. The PCR was necessary for COVID because I have to travel. It was my onus because I could not get into KQ without the test. The question is, how do we link the lab with the clinical care?
You know, during HIV, just to add one more thing, you remember Dr. Wala, we were once told that if we have an HIV test for a husband, and if the wife comes in and asks, is my husband positive? Should you tell them? It was a big debate we had. We went through all that, and we went through the law saying the health workers in Kenya now have a right to let anyone at risk know. Legally, no regulator is going to take you to task. So if the wife wants to know and you don't have consent from the man, the medical law right now allows us to do that. So if a wife, if the man result has to be informed to the wife that this PSA is pretty high, can you please look after him? Is that something, is that a direction we should go for better livelihood, better life expectancy? So there is that, or you take personal ownership. I'll just leave it open.
Food for thought.
Food for thought. It's a debate.
Before we close and go to the AFDB speaker, I would like to ask Dr. Wala, the theme of this conference is the role of the private sector in advancing men's health in Africa. We've talked a lot, and I'm happy I heard the word action here. When we talk about action, in your view, what were some of the low-hanging fruits or topics that can cultivate that action?
So thank you. From this conference, what I got is there's that culture of secrecy, or the culture of silence. So my take home is, how do we break this silence? How do we start talking? And I think this conference is a trendsetter, as Dr. Amit said. So let's start talking. And I remember posting about vasectomy on my timeline. I don't know why Mary Stopes did not acknowledge me with the 250 men who showed up. But there was so much resistance because, you know, we have this culture of the unknown, the fear of the unknown. But this brave man said, I want to. I've seen how my wife is suffering with contraceptives. I want to take this bold step. And he did, and he went for that. Let me tell you, the men did not write there. Actually, they condemned, but the men showed up for the clinic. So I think the low-hanging fruit is let's start talking. And this is one of the the beginning of that. Yeah, thank you.
Thank you. Thank you. Dr. Mansour, you elaborated a bit, but very concretely, low-hanging, easy to reach action, fruit, advancing men's health.
I think if you look at AKU, which is a private, not-for-public, not-for-profit center, we have, at least for cancer, prostate cancer month, breast cancer month, cervical cancer month, we have agreed amongst ourselves that for our faculty and our staff, we'll give them a significant subsidized rate to come forward. The data shows less than 20% will make themselves available for that. So we have to find a way to say, okay, we will help you with your insurance premium or your car premium, come in and get the test done. So I think, and we should offer the same thing for the public at large. But that has to be tied in with the federal government somehow helping out and encouraging in some way. The NHIX of the world should be able to participate. So I think those are important things. You know, when I first come to interview at AKU about 4 years ago, I was staying at the Serena, and the driver was taking me to AKU, and there was a talk show host, and he was very animated, as animated as the previous panel was here, and he was getting all kinds of questions, sexuality, witchcraft, etc. And the man was just winging it. Well, I said to myself, boy, if that guy can do it, I can do it. So I've been saying we should have our own talk show. I think the public sector, the private sector could have a talk show once a week, invite different experts, public health, family medicine, oncologists, experts in the field to come and answer questions in a very logical, methodical, and peer-reviewed, data-driven way. That would be fantastic. And next time, if you do a women's health, bring the women and the men together. You'll have twice as much here, and better be sure that the men come with their women and nobody else's women. But I think that'll be great to do it this way. I think it would encourage all of us to say that the men will pay attention to the mammography for their wives, and the wives will pay attention for the PSA. And no, they obviously they'll come in their own ways, but at dinner, they really should come as a family. I think this should be another initiative that we should take. And it is not just AKU, MP Shah, Nairobi West, all of us can participate in those monthly events. Heart Disease Month, Breast Cancer Month, we can all do it together. And somehow NHI could say, would subsidize the prevention, because prevention certainly will save the federal government quality of life, human resources, and employment opportunities for our men and women.
Great, thank you so much. I've learned a lot today. I would like to give our panel a clap. Thank you so much. Before we really close, and I'll give the final words to our great moderator of the day, I think we have an address of somebody, and you can announce. Yeah, please take your seats.
Just sit, and then we listen
Photo.
to Dr. Babatunde, then you take a photo. Oh, I see what you mean. All right.
Hello, good evening, ladies and gentlemen. Thank you so much for the great invitation to participate at the closing ceremony today for this very special event. I want to congratulate all of you for everything that you have done. Let me perhaps...
Now
hello.
we'd like to welcome back Dr. Babatunde Omilola. He's the Director of Public Health, Security and Social Protection at Africa Development Bank. Over to you, Dr. Omilola.
Thank you very much. I hope you can hear me. Just confirm if you can hear me. Hello, can you please confirm if you can hear me?
Yes, we can.
Hello? Say that again.
We can hear you loud and clear.
Oh, very good. Thank you so much. Thank you for the invitation and congratulations for everything that has been said. I believe that this is a very topical issue to address. Let me, by way of background, say that men actually have specific health needs that require a better informed and planned response. I will give you a few statistics to justify this. Globally, average male life expectancy at birth was 71 years in 2019. Average LD life expectancy for men stood at 63 years at the same year in 2019. For women, life expectancy was 76 years and LD life expectancy was 65 years. So in a way, there are wide variations between and within countries when it comes to issues of health. Now, a boy born in Japan or Switzerland in 2019 can expect to live for 82 years, while a boy born in the same year in Lesotho can expect to die at 48, 34 years earlier than a boy born in Japan or Switzerland. Men are particularly vulnerable to cancer, especially prostate cancer, and men are twice as likely to die as a result of suicide. 25% of men with HIV are actually unaware of their status, and 45% of men with HIV are not receiving antiretroviral treatment, and 53% do not have a suppressed viral load. These figures are similar for men with tuberculosis and for common mental health conditions such as depression and anxiety. That reflects the differences in terms of health outcomes between men and women. And as a result of this, what you see in terms of the key issues for men when it comes to health, I want to emphasize very quickly 5 of those issues. The first of them, it's around service usage patterns and preferences as well as barriers for men. The second, it's about lifestyle and risky behaviors of men. As you all know, men generally have less healthy lifestyles, and men generally adopt fewer health-promoting risky behaviors, e.g. misuse of drugs and alcohol, than women. And this, of course, is due partially to social ideas about masculinity and gender roles. Third, in terms of key issue, knowledge and understanding of health and illness. Men's knowledge of health in general and of specific diseases such as cancer, sexually transmissible infections, and heart diseases and their risk factors, as well as improved nutrition and diet, is often poorer than that of women. Fourthly, the influence of masculinities and gender roles, which I highlighted earlier on, which also relates to the idea that in most cases, men generally don't seek help until it is extremely late when it comes to health issues. And finally, biological causes of illness. Some illnesses are sex-specific, as you know, as I mentioned earlier on, prostate cancer or erectile dysfunction, hormonal and other biological differences between men and women can also affect morbidity and mortality, especially for non-sex specific diseases. Having said that, let me say that one of the key ways to deal with this issue should be through gendered approach to health in terms of health service planning and delivery, health promotion, disease prevention strategies, which are of course commonly gender neutral, but these should actually now become more gender sensitive. Nevertheless, evidence also shows that in many cases, in fact, a gender neutral approach can contribute to greater health disparities between men and women. And that's why we need to use a gendered approach to health and make health gender specific. And a gendered approach would support greater understanding of the different health risks, needs, attitudes, and behaviors of men and women, which would of course lead to improved health service delivery and outcomes for both groups. Now, let me move quickly to the what we should be doing. One of the things that we should be doing should relate to data and evidence. We need more data, we need more information, we need more analysis. We need more disaggregated data for men because this is extremely low. This would help us to be able to see the wide-ranging and different issues affecting men when it comes to health. So the collection, the quality assurance and publication of wide-ranging and regularly updated data on men's health is absolutely essential. We also need to understand our target audience and their characteristics because they will differ from places to places. in terms of identities, but also in terms of relationships. And these can help us to deliver and design gender responsive programs to improve men's health. Also, I believe we need to engage more with policymakers to drive change, but also to attract private sector. And I'm glad today that what I've had in the closing ceremony, we have talked a lot about what the private sector bring to the table when it comes to health issues for men. And I think also we need to be at the forefront of the political agenda by prompting private sector investment for solutions when it comes to men's health. Let me begin to wrap up very quickly to say that one of the ways that we see at the African Development Bank when it comes to men's health is through the digital health landscape in Africa, which is of course growing at an exponential rate, with sub-Saharan Africa being an implementation of digital health innovations as a tool towards health system strengthening on the continent. And so Africa, as we know, has been home to some of the best digital health implementations in the world. Prominent examples include the first ever use of drone technology to deliver blood supplies pioneered in Rwanda, thanks, of course, to the partnership between the government of Rwanda and the California-based robotics company called Zipline Incorporated. Another example is the successful rollback malaria partnership which established the SMS for Life program, led by Novartis, to eliminate stockouts of anti-malaria drugs in public health facilities across the continent. At the same time, we've seen the great penetration of the use of mobile phones in different parts of the continent, especially in terms of detecting fake drugs, as we have seen in Ghana, and also in terms of having access to digital health facilities in different parts of the continent. Now, as we know that these growing efforts to continue to enhance digital health space can help us to tackle many of the challenges that men are facing when it comes to their health, especially in terms of disseminating health information, but also in terms of monitoring personal health through mobile applications. For us at the African Development Bank, we have shown great support for digital health since 2012. Of course, acknowledging the impressive information revolution on the continent in terms of ICT innovations, but also in terms of services needed to deliver these for people on the continent. So as a bank, we recently formulated and developed a brand new strategy for quality health infrastructure in Africa. This is the first strategy on health at the African Development Bank. Our board of governors basically requested us to articulate our strategic framework going forward when it comes to health in Africa, especially as a result of the COVID-19 pandemic. And as a result of this, we have launched this particular strategy for quality health infrastructure in Africa, which is basically looking into three categories of health infrastructure: primary health, secondary and tertiary healthcare infrastructure, as well as diagnostics infrastructure. Across all these three categories of health infrastructure, the bank will be investing in ICT connectivity to support innovations in health service delivery in terms of digital health and telemedicine. And this will be extremely useful, especially in forging public-private partnerships between our regional member countries and private sector ICT providers to be able to pilot and scale up innovations in Africa to ensure sustainability and ownership of digital health services by governments in different African countries. As a result of this, as a bank, we know that the investment in health infrastructure on the continent is extremely low. It's about $4.5 billion every year, and what is needed is $26 billion every year in health infrastructure. So our plan as a bank with our strategy is to spend at least up to $3 billion in the next few years until 2030 around developing both private sector and government-led health infrastructure projects across the continent, and also PPPs. In addition to that, we also have a pharmaceutical action plan, which has also been approved at the bank, which would help us to stimulate local production and manufacturing of medicines, of drugs, and also of badly needed vaccines on the continent. It would also help us as we have also launched a brand new African pharmaceutical foundation through the support of the board of the bank. Now, in conclusion, ladies and gentlemen, I want to say that for us to find solutions in terms of dealing with health situation of men on the continent, digital innovations offer solutions that we can use to engage men for health promoting behaviors. We've talked about mobile penetration, which can allow men to have access to health services, to applications, to programs that can be very useful in terms of making sure that we deal with health positive behavior. As a bank, we are actively supporting increased ICT connectivity, as I mentioned earlier on, through our new strategy for quality health infrastructure in Africa. In addition to this, research and programming must be strengthened in engagement of men and even boys. And this must be intentional in promoting a gendered approach and also ensuring that qualitative evaluations are useful and necessary and applied to improve rigor, robustness of research on men's health. So again, let me thank you so much for the invitation. In particular, I thank you, Dr. Amit Taka, always for the invitation. We look forward to working closely with all of you. And thank you so much once again. Thank you.
Thank you very much, Dr. Omilola. Those of you in diagnostic imaging and people who set up hospitals, I think you were interested to hear that the bank has a strategy to increase the scale of healthcare infrastructure, including diagnostic, and also supporting digital health solutions. So please make sure that you follow up on that. And AHB is always happy to provide advisory services in that regard. We have come to the end of our one-day conference. It feels like it's been 3 days because of the amount of content, the caliber of people who were speaking. So allow me at this point to thank all the speakers of the day. Please, let's give them another clap. I'd like to thank Trademark Hotel for hosting us today and giving us a lovely meeting room. Thank you very much. I would like to thank our event sponsors, and I want to recognize all of them by mentioning them: ECH Alliance, Cosmos, Smart Applications, Clinique Research, National Cancer Institute, that also gets the award for the most beautiful booth, PS Kenya, AstraZeneca, Vitality Health International, Lumira DX, the Aga Khan University Hospital, North Star Alliance, UNICAF, Neural Labs, and the Kenyatta University Teaching, Referral and Research Hospital. Let's give them all a clap. I would also like to recognize AHB staff that have tirelessly put this together for many months and days and nights. So if you work at Africa Health Business, please be upstanding so that we recognize you. The team at the back on the comms. That's the team that makes things happen. Thank you very much, team. I don't know why we keep doing this conference, because it just takes the life out of us, but we shall keep doing it. And I'll shortly tell you the venue and the theme of the next conference. But I want to thank you all, and I want us all to give ourselves a clap for staying here the whole day. Thank you very much for coming to this bold event. We didn't know if anybody would show to talk about men's health, but I think we have started a conversation, and I believe if we have another men's health event, there'll be much more interest, Amit, and we look forward to seeing the traction that will come from here. So now let me tell you where we're going to meet next, not necessarily about men's health, but the next stop is in April 25th and 26th in Johannesburg. We're going to be talking about the role of private sector in the new public health order. I'm not going to tell you what that new public health order is. Please start booking your flights. You don't need a visa to go to Johannesburg if you're from Kenya. So let's meet there and let's have the next AHBS talking about our role as private sector in changing the trajectory of our continent with regard to infectious disease and other health threats. Asanteni sana, enjoy your evening. Bye-bye.